So today I will tell you about the uses of Dicip Eyedrop. I'm your pharmacist, Dr. Abdur Rafy. I'm doctor of pharmacy. I have a specialty in pharmacy. I'm a drug expert, and you're watching Rafy Healthcare channel. So let's start. Its brand name is Dicip and its generic active pharmaceutical ingredient is ciprofloxacin. It is a 5 ml eye drop and its manufacturer is James Pharmaceutical. It is used to treat bacterial infections of the eye. It is used to kill bacteria in the eye. It is used in the treatment of bacterial conjunctivitis and corneal ulcers too. It's an it's an antibiotic eye drop and it is used to treat bacterial infections of eyes. So it's a very good and effective medicine for the bacterial infection. It is only used for the bacterial infection. It doesn't treat the viral or fungal infection of the eyes. Okay, it is only used for bacterial infections. Now let's discuss that how to use this medicine, how what's the treatment and how to use this eye drop. You can see here the dosage in corneal ulcers, 2 drops into the affected eyes every 15 minutes for the first 6 hours, then 2 drops every 30 minutes for the rest of first day. It means that you have to put 2 drops every 15 minutes for the first 6 hours when you start the treatment. Okay, then after this 6 hours, then you will start 2 drops every 30 minutes for the rest of first day. This is your first day treatment. Okay, on the second day you will come to 2 drops every hour, means you will put drops in your eyes every hour. First you were putting 15 minutes and then 30 minutes. Now you are doing every hour. Okay, on the third day and onwards to the 14th day you will put 2 drops every 4 hours. Okay, from third to 14th you will add 2 drops every 4 hours, and the treatment can be continued after 14 days if corneal reepithelialization has not occurred. Means if you haven't got cured from it, you can continue this treatment. Okay, after 14 days you can continue this treatment again. Now for the bacterial conjunctivitis. It has 1 to 2 drops into the conjunctival sacs every 2 hours while awaking for 2 days, and every 4 hours for the next 5 days during awaking hours or as directed by the doctor. Means you have to put 2 drops in the eyes for every 2 hour for the first 2 days. Okay, in first 2 days you have to put 2 drops every 2 hours, and then the third day to fifth day you will come every 4 hours. Okay, 2 drops every 4 hours. I hope I have explained you properly. This was the dosage by the company, that how to use this medicine, but I would advise you that you should consult your physician and pharmacist. They will assess your condition and they will give you the treatment according to it, because the condition of the patient varies, so the dosage also varies. Okay, if your condition is critical, then they will give you, might be possible that they will give you more uh, drops or prescribe you more drops, that you should add 4 to 5 drops. Or if your condition isn't severe, so they may have say that you only have to put 1 drop or 2 drops. Okay, so if you have been prescribed by the doctor, by your physician and pharmacist, that you should use this like this, then you can go and follow your treatment of the doctor. Okay, so that's for today. I hope you found this video informative. Thank you. So I hope you found this video informative. Don't forget to subscribe my channel and also like and share my video too. If you have any question regarding this medicine or any kind of medicine, you can write in the comment section. I will reply you. And now take care of yourself and always remember your pharmacist Dr. Abdur Rafy in your prayers. Allah Hafiz and take care.